Hello, my name is Khumbo Jere. I'm a gynecologist and obstetrician working in Namibia. I came here to attend a 3-month training in advanced reproductive technology. So I got to know about the Merck Foundation More Than a Mother initiative when they came to launch in Namibia. I was one of the lucky few who were invited to attend the training session and the launch in the capital city, Windhoek. After the training and the launch, opportunity came up for me to come and do a 3-month IVF course, and I took it up. So far it's been a good experience for the past 3 months. We're now completing our final 3 months, and from what the training day 1 to now, it's really changed my perspective of how to manage patients with infertility. And I will go back well trained, thoroughly experienced, and with more knowledge on how to handle and manage couples with infertility. So Namibia has a population of 2.8 million people, and the country is quite a vast country. The distances from one city to the other could range over 500 kilometers. We only have 2 IVF centers in the country, which are based in the capital city, Windhoek, and 3 currently practicing fertility specialists. One of them is South African, who just comes to visit, and 2 of them are local from Namibia. Embryologists, I think there is one who comes from South Africa to one of the centers, and the other center also has one who's also visiting. So currently none Namibian trained embryologist. In terms of provision of care in the peripheral and in the primary level, government hospitals and the other private hospitals have got just general gynecologists who can screen for the conditions involved with fertility. They can do basic blood tests, ultrasound, and other investigations like hysteroscopy and laparoscopy, and then refer the patient to the center. Others have to actually travel to South Africa because of preference, currently only having 2 in the country. But that actually is a problem as well, so there is need for more availability of the service to improve access of care. Furthermore, in the government sector per se, the gynecologists are few, so already there's a burden of disease managing other conditions other than infertility. So most of the patients don't always get proper treatment, and some of them are left hopeless, not knowing that there is a possibility of having a child by this modern technology of IVF. So those are the patients in the community who will benefit so much after we have more established service in the country. So on terms of a social impact, infertility is quite a big challenge. Couples who are seen, mainly it's thought to be the woman who's a problem. You find a unique scenario like in a country like Namibia is where couples are living far apart. One is working in another city or another town, 500 kilometers away from the other. And expectation is when the husband visits a wife, or the other way around, that time they will conceive. And if nothing is happening for a duration of over a year or so, it is possibly the wife to blame. So already the stigma pushes towards a woman to be the one who is at fault. Men may sometimes have another spouse because they think the first one is not bearing the children for them, but in actual fact the problem needs to be solved by both ends, investigating the woman and the man. Stigma is there in the community in terms of a couple who are married or together for a few years. The expectation is they will have a child, and if nothing is happening, already that woman can be ostracized, seen as a lesser in her community because she's not having children. So she's also affected by that. So it has a huge impact on them, and some go into depression, some parasuicidal, because they think they're not worth it to live. What are they living for if they're not able to provide for one of the very basic needs in their family, which is to have children? So in terms of awareness and perception of the people, A lot of people are still believing that once a couple is infertile, the only hope is through God, one day they will get a child. That's the majority of the people in the rural areas. The more of the educated people are the ones who are aware that they can seek treatment by seeing a specialist. Actually having access to seeing a specialist as well is not that easy, because very few people are practicing gynecology in the country, so access to them is a challenge. So awareness in the community is only brought about by nurses and junior doctors. But the rural areas, the perception is they only pray to God that possibly there could be a hope of having a child one day. But as we getting to know more about IVF and infertility management, we are looking forward to doing more campaigns. So the awareness campaigns currently at the Ministry of Education and Ministry of Social Services, they are conducting the programs to reach out to the community. And furthermore, as a team, once we have trained and completed our training, we also get in touch with them and also help do projects where we can actually scale up the awareness region by region. Also do more training like involving nurses who can actually spread the message more. And yeah, so we're at an early stage of awareness, but we hope to get there. So in terms of improving, the few plans that we have after doing this kind of training is, essentially this training has renewed and opened more doors to how to manage patients more thoroughly, and also just correctly. There is the first impact of understanding the disease itself, the disease process, understanding the anatomy and physiology of the reproductive organs, understanding how a problem comes in, how it progresses, and how the long-term impact comes in. So by understanding this process now to the point that we now seeing the treatment options, looking at cheaper options, looking at intermediate options, and then looking at the high-end options, we'll be able to stratify and categorize patients accordingly. So first of all, when we go back, aims are on awareness campaigns, conduct clinics where we can actually do like camps where we can book patients, get them screened, look at the ones who have different challenges, look at what they're able to afford, what are their options. Then the second thing is also amongst our other clients. Other group of clients is doctors, the general practitioners, and the other general gynecologists, to bring awareness to them that instead of sometimes just holding on to patients and treating them consistently with medication which they're not getting any outcome in terms of improving the woman's fertility, they should refer to a center where there is someone with an expertise to manage fertility problems. So awareness campaigns, reaching out to people, improving out on the social awareness campaigns, either by media, television, and word of mouth. And then at our center in particular, we will be looking at focusing on how to do natural cycles correctly, focusing on doing intrauterine inseminations correctly, and then a few who are not able to manage, we then subsequently refer them to a center. And as we grow 6 months to a year, we should probably be established more to do IVF at our own practice. And by that time, hopefully at our center, we should also have an embryologist who's been trained, and we can actually coordinate and do more IVF advanced technology training and treatment there. So for aspiring students, this is a training to look forward to. I think for young gynecologists and potential embryologists, once you acquire this kind of training, there is fulfillment in completeness of your management of patients. You see patients who had no hope and had nowhere to go, and now you can be able to offer them some light. Those who have suffered so many years of childlessness, and you can become the change in their lives. Not only do you reach out one couple, but the word spreads. Once a successful couple comes to you, they spread the word to others. And so as a country, we improve the markers of infertility. We can improve on conditions that lead to complications. And in fact, as the WHO level, the required cycles, the median population of a country is 1,500 cycles of IVF. to actually to be a minimum. And Namibia currently, we're nowhere close to that. Probably we're doing 30 to 60 cycles for the whole country per month. So there's a lot of room for growth. There's a lot of challenges, and the more numbers of qualified specialists in fertility, qualified embryologists, the more we can come closer to closing the gap of underservice that is in the country. Interestingly, fertility was not my first primary area. I thought I would do urogynecology, managing patients with complications as complications from, say, delivery and everything. But as I worked day to day in my career, working in government hospital, working in the private sector, a huge expectation came from patients, and more than 50% of the patients would come had an infertile background. There was a couple, one couple comes in with chronic abdominal pains, but long term you hear that their problem is they're not able to have children. By and by, so more than 50% of my patient load are patients with problem of infertility, and by that my interest grew. How can I help in? How can I close the gap? And then when you hear stories of some of the atrocities that women go through, not only in my country and the surrounding countries, it really sparked the passion for me to be a change in the community, to get to the nitty-gritty details of how to manage these problems and take it back to Namibia and reach out to the community, both the guys who are working in improving the doctors' knowledge, who are working in the remote areas, improving the nurses' knowledge on how to screen and bring awareness and teaching them their clients, and then finally also to help to now provide treatment to people who are not able to access huge costly interventions which are done in South Africa and Vindu. So if we take low-cost IVF treatment to the community in our towns, we hope to make a change. Overall, after attending such a great training at Milan, the Fertility Center in India, Bangalore, we're grateful and really appreciate the efforts Merck Foundation has done, and the whole team, Dr. Rasha, Kelej. This training has been a great eye-opener. It has made a difference, and I hope to take the knowledge, the skill set back to Namibia and touch the lives of many there and inspire more people to attend such training so that we can, as a bigger team, we can make a huge change. So thank you to Merck Foundation and all the other countries which are participating in this same initiative. We're all grateful to the Merck Foundation, and once again, thank you to the team.